Our top story tonight, Wisconsin health officials confirm one Wisconsin child has died after contracting a little understood liver disease. The CDC and World Health Organization are investigating the acute hepatitis, which has been identified in several states and foreign countries.
And CBS 58's Adam Reif is live in the studio to explain what health experts are now watching for. Adam.
Natalie Jessup, good evening. Hepatitis is a general term indicating liver inflammation. This acute hepatitis is impacting otherwise healthy children. The Wisconsin Department of Health Services has identified at least 4 cases in the state, and 2 children had severe outcomes. One needed a liver transplant, the other died.
Disturbingly, in some of these cases, the liver failure has been very severe and required liver transplantation. So this is something that potentially could result in death.
It's a race against time as the medical community tries to understand an acute hepatitis disease that is impacting children. In some cases, it's been deadly. Hepatitis can be caused by different things, and many of them are viruses. But while the CDC says all patients tested negative for hepatitis viruses, they did test positive for what's called an adenovirus.
Adenovirus, which is one of the possible causes of this outbreak, there are some treatments. They're fairly heavy-handed and would only be used in relatively severe situations.
Those treatments can include medication for mild cases or transplantation for the worst cases. In a typical year, 4 to 6 Wisconsin children are hospitalized with hepatitis. Symptoms include stomach pain, vomiting, diarrhea, and yellowing of the skin or eyes, what's called jaundice.
Parents should make sure their children are up to date on hepatitis A and hepatitis B vaccines. Those are given in childhood and are 2 very preventable causes of hepatitis.
The CDC and World Health Organization are trying to gather more information, starting with blood tests or biopsies. Then hepatologists or liver specialists will develop a battery of tests to detect the cause. Doctors believe this disease is having such an impact because immature immune systems cannot fight it off.
I think it might not do so much with the liver of the child as the immune system of the child, that the immune system is less experienced in handling these and getting rid of these infections.
Now, of the first 9 U.S. cases, they were in Alabama. None of those children had COVID-19 and none were vaccinated against COVID-19. The Wisconsin Department of Health Services has not shared additional information about the acute hepatitis cases in this state, and DHS is not sharing where the